Okay guys, welcome back to the part 2 of this video. Just as I promised you all, without me wasting much time, let's just go straight into today's video. Okay, so it's all about adaptation. Please, if this is your first time of coming across this video, if you haven't watched the part 1, which was just about my experience and a bit of adapt into adaptation, please remember to watch the part 1 before you watch this video. Okay, so now let's receive Mavis from Galway University Hospital, who is also going to share a lot of input for our midwives. And then we are also going to receive Nathan from St. James Hospital for the registered nurses as well.
Hi everyone, I'm Mavis. I'm a midwife here at University Hospital Galway in Ireland, but I'm originally from Ghana. Just to add a few bits to what Lucinda said, the first thing I would want to talk about here, midwifery practice here, is that though they consider your skills and your knowledge in midwifery, like the basics, palpation, vaginal examination, observation of the woman in antenatal, postnatal, labor, and everywhere, they still usually go with fetal monitoring using the electronic device called CTG. It is an electronic way of knowing what's happening with baby in the womb of the mom. Okay, so I'd encourage everyone hoping to be here, starting adaptation or even working, just to keep reading, knowing more facts about the CTG. You can get stuff from YouTube, Google, anywhere, and just search CTG and then they will give you that information. You can get ebooks, you can get demonstrations, you can get understanding and explanations from there. The second thing I would want to talk about again is that there is a program here, there's a program on Netflix. It's called Call the Midwife. Call the Midwife. It gives a better picture as to what's happening in the labor room, more especially. So you'd want to get that video. It's a series, so you can, if you have the Netflix account, you can just go there and have a watch. It's very nice. It's very, very useful. It gives you a mental picture as to how things are done here. It's quite different from Ghana or Africa and anywhere that you're coming from that is not in the European or in the Western world. So that is it. And then the second one the third one actually, is that you have to know your hospital protocols. So every hospital is different. Every management is different. So the obstetric management that is basic in Ghana, like for instance, if it is PPH, everywhere you go, PPH, you do A, B, C, D. Here it's different. So it's like hospital based. So you just have to know the hospital you're going to practice or work and know their policies and just go by them. Okay, and again, you have to build your self-confidence, build your personality, have a very good communication skills. It's a big thing here. Know how, when, and what you communicate to your patient and relative, to other team members. Let them also understand you. If you are saying something, if you are doing something, they want to understand you. Here, they just don't take your skills, okay? They take into consideration your rationale, the reasons why you do stuff. It's very key. So that's your communication. You have to work on that and build your personality, build your confidence, get loads of information, knowledge-wise. Go for your Margaret Mouse and then just go through the book, the management for every form of thing in pregnancy, delivery, and then postnatal. It's what they use here. It's what they practice. They practice what they are taught. They practice the book. They don't just practice something and leave the other. So it's very, very basic that you go back to your Margaret Mouse, get your knowledge, get your skills, the V's, your palpations, and that's the last one I would want to talk about is getting your documentation right. They are very detailed. They don't like scanty stuff. They want detailed information. So right from what the pregnant woman has been doing, her past medical history, every medication history, everything she's experiencing, everything. Very detailed information. If it is in the labor ward where I work, They want you to document the tiniest information, the tiniest thing that happens. So it's very important, it's very key. You are detailed with your information, with your notes, with your documentation. You don't leave anything out, because the thing that you think might not be useful might be useful at some point in the care of the woman. So these basic things, the communication, building your personality, your confidence levels, getting to know the CTG, all the indicators with the CTG, and getting to know the hospital protocols is very key. And then again, you can watch the Call the Midwife show on the Netflix, and then get information, build your skills, build your knowledge, and you'll be fine. Adaptation is very, very difficult. It's one of the toughest process of the whole thing, but I'll say that you can do it. You can, because we've all done it. Not easy, but you can. Just get your skills, get your knowledge, and communicate properly, and you'll be fine. Bye.
Hi, my name is Nathan. I am a nurse and I'm practicing currently in Ireland. I just want to share a few things with you with regards to how the whole adaptation process goes. Some tidbits of like what you should be doing within your first weeks, from your second to fourth week, and then from your third to sixth weeks, and then probably your final weeks during which you will be signed off. So most of the time, the first week, you're only expected to do observations. What I'll tell you is that that's your grace period. So you should, in quotes, you're allowed to probably, not shoulder all the responsibilities. What you should be doing during that time is that take your time to ask all the questions. You might probably be allowed to do certain basic stuff like checking of vital signs and maybe blood glucose monitoring, intakes and outputs and those things. Make sure that you get everything on point. I'll say from the second week, you will be given a caseload of a minimum of 2 patients. So you will definitely be working with your preceptor during your second week, and you'll be working and depending on how competent you show yourself to be, either direct supervision or maybe distance supervision. During that time, I would encourage you to keep a keen eye on your patients. Your communication should be on point, and when I say communication, it relates to how you speak with your colleague nurses, how you speak with other MDT members, the doctors, physiotherapists, nutritionists, medical social workers, and then how you speak with patients, most importantly, and then their relatives, because if you think of healthcare as a business, the patients and their relatives are our customers. So you are being monitored on all those kind of things, and then how clearly you communicate. And so if your patient is scoring a high EWS score, how fast do you escalate? Maybe you have checked and your patient's bloods are abnormal. It could be a low HB or something. You were able to spot that. How quickly do you escalate that? See, don't be scared. The science is always universal. An abnormal temperature is abnormal temperature wherever you're coming from in the world. So be bold and then be confident enough to communicate it. Those are some of the things you should be doing during your second and fourth weeks. At that time, I'm pretty much sure that depending on the workbook you're using, you'll be expected to do some reflective writing. I think that's now becoming a generalized thing for NMBI. You have to do at least 2 to 3 reflective writings. You should be completing that. You should have an incident to write on. And but while doing all these things, stick within your domains of competence. These are things that will be spelled out to you when you start the adaptation. You'll be given a handbook containing the do's and don'ts, or the things that you're allowed to do. I would say by your third week, I'm not too sure, but you should be able to start administering oral medications under direct supervision, of course, and then you can still give insulin pens under direct supervision, and you will be able to do wound dressings from that time. From your 4th to 6th weeks, you should start exhibiting more autonomy. I know one thing for most people and most of us, I would say, is that when we move in and we come in that fresh, it's like the transition, one with the language and with the protocols, with all the abbreviations that you're likely to meet on your local wards. Everything is like being thrown at you all at once. But by your 4th, 5th to 6 weeks, those things should start sinking in. You should be exhibiting more confidence, and you should be able to handle an increased caseload between 4 to 6, because that is what is going to be expected of you under normal circumstances, and maybe under abnormal circumstances, depending on the pressure in the ward. You might be given other additional tasks. So at that stage, yes, and you should have completed all your active writings, your medications that you're supposed to learn. I think, okay, where I did my adaptation, I was supposed to learn at least 6 new medications every week. So that made it like, if 6 weeks, then 36 new medications. And obviously, they wouldn't be extremely new to you. Probably it's just going to be the trade names that are different and all that. Just familiarize yourself. Now, one more thing is that you will face new expressions, new abbreviations, new procedures, which you were not previously exposed to. On your off days, I would suggest that, take your time, read about it, watch all the YouTube videos. I'm sure that locally you will have PPGs, like, policies, procedures, and guidelines. That's what I mean. Download them, see how your hospital goes about those things on your off days, because that is likely where you will be working for the next 2 to 4 years. So the earlier you start, the better. And the more you're able to demonstrate a lot of confidence and competency, the easier it will be for your preceptors to sign you off. Okay? And just be open, be nice, be yourself, be confident, and I would say usually everything should go on well with you. And if you're having challenges, or maybe you're getting negative comments, or maybe not so good comments, I would like to say, try and work hand in hand with your preceptor. Say, oh, hello, you wrote so and so, I worked with you today, and okay, I think that's true. When next are you on duty? I'd like to work with you again, and then to see how best I can improve on that. And at the end of that set date, when you're done, make sure you go back to the same person to give you a positive feedback, or, a feedback reflecting how you have actually performed. Okay, that is one of the best ways to ensure that, yeah, I'm on track. Yeah. So, guys, it won't likely be so easy, but with due diligence and a bit of consultations. Sometimes the mistake most of us do is that when things are not going so greatly, we keep everything to ourselves, and then when things get really bad and probably we are not signed off, that's when we start sharing our grievances. By then it's too late. Don't hide your problems. Everybody went through it before, and it hasn't been rosy for everybody. People will be very, very transparent with you. People will tell you their true experiences. That is not to say that it is horrible or it's not pleasant. With the right support and with the right advice, you will be able to make it through. So that's a little I have to tell you, and wishing you all the best in your adaptations. And cheers. Try and support Mama Lucinda's channel. She does all the best work when it comes to adaptation stuff. And she has an amazing Telegram group. Try and subscribe to that as well. You have all the information over there. And reach out to other community members if you have any concerns. I'm sure they'll be able to help you. Cheers. Thank you very much. Bye-bye.
Okay, Nathan and Mavis, thank you guys so much for sharing all those juicy informations with us. We really appreciate it. And I hope that it's been of great benefits to my midwives and also my nurses out there. So if you're already a nurse in Ireland and you wish to share any information with any of us, please remember to drop it at the comment section. It is very much welcome. Also remember to like this video and also share if you find this video very helpful. I appreciate you guys always coming around and always supporting this channel. The name is as Momo. See you all soon on my next video. Bye.